Hi, everybody. Thanks for showing up in person. Those of you that are here and not sick with the flu, which I've been hearing a lot of folks tell me that they are not here in person today because of that, and I thank them for not exposing all of us in good public health fashion. Hello to those on Zoom as well. Thank you to our to all of you for joining us for our next installment in the Leaders in Public Health series. Today with Dr. Stephen Morrison, in partnership with the Yale Institute for Global Health. I think we scheduled this a long time ago. We've been working for a while on finding a date for Steve to come and visit us, but we could not have had him coming at a better moment, as we are all grappling right now with the dismantling of USAID, the impact of executive orders, and kind of the shifting tectonic plates in the world of global health and public health. Could not have had a better speaker to come and join us this month than you. So I'm going to provide, as you guys know, a brief introduction of Dr. Morrison, and then we'll have a little conversation for about half an hour, and then we're going to open it up to questions, both for those in the room and those of you on Zoom. So start thinking now about kind of what you might want to ask. As a reminder, this is, again, being broadcasted and recorded, so everything is on the record. So just as you are thinking about your questions. So Dr. Stephen Morrison is the Senior Vice President at the Center for Strategic and International Studies, otherwise known as CSIS, based in Washington, D.C. Dr. Morrison currently leads the CSIS Bipartisan Alliance for Global Health Security, which shapes discourse in Congress and the administration, as well as with international partners, around pandemic preparedness, HIV/AIDS, immunization, climate and health, engagement with China, provision of health amidst wars, and much more. Dr. Morrison not only leads that global health security work, but also writes extensively and appears widely in the media on U.S. policy, having led health global security events at everything from the annual Munich Security Conference to creating a broadcast program about the human toll of the war in Gaza, to creating an award-winning documentary on the effect of violence against the healthcare sector in Syria, Yemen, and Afghanistan. He holds his PhD in political science from the University of Wisconsin-Madison, where our own Nida Ahuja is heading to be chancellor of their med school, which is super exciting. And he's also a magna cum laude graduate of Yale College. We do like to bring our fellow Bulldogs back. He majored in English, did not work with a public health school during his time here. We'll forgive him for that. So we're happy to have him here now joining us. Has many deep connections to Yale and to the School of Public Health. And I consider him a friend and mentor. So it's really just an absolute delight to have you here today.
Thank you so much.
So I'm going to start us off with a chance for you to share a little bit about your personal story. I alluded to it in kind of that lovely long bio. But you started out as an academic political scientist and then made your way into the policy world in Congress and the Clinton administration. I'm curious about that journey for you, kind of how you went from academia into Congress and then into the world of health policy and global health security. Can you share a little bit? How many of you all are students? So to give you a sense of who's listening here, faculty and staff. Amazing. And how many of you would say you're working in global health? So just to give you a sense of who you're talking to and kind of as you share your story, who you are going to inspire to potentially follow a path like yours. So would love to hear a little about that career path.
Okay. First of all, thank you so much for this opportunity. I'm delighted to be here. It's taken a while. I really appreciate it. I know this took an enormous amount of effort to organize. Very grateful to Holly Zuller for her work on this, and to Mike Skonechny from the Global Health Institute. We'll be hosting some students from the Institute from the school in March in Washington, D.C., which we've done previously, and we're happy to do again. And that's the kind of partnership that I think really matters enormously. So your question around my own pivot towards global health and global health security, in some ways it's a little accidental. But I emerged, I did my doctoral work in Southern Africa in the early 80s, which was culminating crisis around apartheid. I was in Botswana, in Southern Africa, in South Africa. I was on an academic path towards a tenure line sort of career appointment. Out of nowhere came an offer to join the House Foreign Affairs Committee to work on Africa in '87. That was a period when the Soviet Union was coming apart. Many of the long-standing wars were going to be resolved in Africa. It was a period of enormous dynamism in foreign policy and the like. So I decided to not entirely abandon academics. I've continued to be an adjunct and tied to several different universities. And but I went into policy within Congress. I left and went and worked in our embassy in Addis Ababa right after the Mengistu regime had fallen, and we were moving towards Eritrean independence. And then I joined the Clinton administration, worked for the Secretary of State on war and peace issues mostly, and broad foreign aid issues for the Clinton administration. But how did I move towards global health? I mean, I did very, very little on that. I think in the course of being on the Hill, we did one hearing on HIV in Congo, in then Zaire. It just was not a big priority. But what changed was as I migrated out of the Clinton administration into CSIS and the advent of the George W. Bush administration, a couple things were happening. One was the HIV epidemic was surging. There had been a surge of new infections several years earlier, and now they were coming manifest, and this was beginning to be seen as destabilizing and a massive threat. It's a little hard to convey the sentiment of that period, but there was a sense. You had presidents of countries like Festus Mahai from Botswana coming forward and saying, this is an existential threat to our nation, and we need assistance here. And so suddenly you have this threat emerge, and it's ferocious, and it's devastating in southern and eastern Africa. That's one thing. Second thing is it's beginning to be understood and seen as a national security matter. Our national intelligence community was mobilized around it and becoming very, very active. One of the last things that happened during the Clinton administration was then Vice President Gore and Richard Holbrooke, going to the Security Council for the first time ever when the U.S. was in the presidency of the Security Council, January of '90, going to the Security Council on a matter of global health security for the first time ever, which was the HIV epidemic. So this epidemic is surging, it's destabilizing, it's seen as a national security priority by our government and others, and those in Africa itself. We had ARTs, had been around since 96, 97. By the time we're getting into the early part of the Bush administration, they are becoming available in mass-scale generic form after some fierce battles. So this was a moment where it was possible to see that U.S. foreign policy could really change by embracing this. And so what we did, I had gone over to CSIS. I left the Clinton administration to run the Africa program. And I pitched Senators Bill Frist and John Kerry to form a task force in the Senate on HIV/AIDS. And then 9/11 happened. They agreed to do this before 9/11. 9/11 and the roll-up to the war in Iraq changed the geopolitical environment entirely, where suddenly infectious diseases became a major concern in our national security doctrine as a result of this, that bad things could happen in low-income countries that could have quadrupling effects. And in the roll-up to the war in Iraq, whether we like it or not, the George W. Bush administration moved towards launching PEPFAR as a soft offset to that war, and opened a window. And so we formed as an experiment, this task force with Frist and Kerry to try and sketch out how to scale the response and how to move forward. And it was a feeling like our foreign policy was opening a new dimension, that there was this transformative moment when all of those things had come together to create an opportunity to drive a different kind of foreign policy with global health security at its center. So that was what changed my mind and got me excited about this.
I love that. And of course, now we're facing some challenges to PEPFAR, which we will get to, but also a great example of how out of crisis comes opportunity, which I think we'll also talk about a little more over the next half hour or so. So I'm also interested in the opposite. So how many in this room would have thought of national security as being a goal of public health? About a third, right? So that's actually a higher percentage than one usually gets, right? And I think that kind of us thinking about, from our disciplinary perspective, thinking about the tie between public health and national security is something that I think maybe some people in public health are a little resistant to. Yeah. And so I would love to hear from you kind of that opposite side. So you moved from policy into global health. How do you talk about the connection for people who primarily would consider themselves to be in global health or public health? How do you talk about that connection to national security and get them on board with the idea that the two are connected?
Well, I think that you're right that there's a certain natural neuralgia to talking about health and security in the same breath. And it requires some careful explanation. And it does not mean that it invalidates the deep ethical and humanitarian content and motivation around engagement on health. Rather, it's saying that dangerous threats in the health sector have, by definition, a deep security dimension to them, and it is what motivates people to pay attention about protecting Americans and others. And that we have seen the proliferation in the last few years of, at ever higher velocity and threat, of health security pathogens emerge that we have got to be prepared for. And part of it is joining partnerships with other countries to build their capabilities. But, we can go through the long litany of challenges that brought us up to COVID, but it was a proliferating, ever more rapid and ever more higher velocity and higher impact. And so that's one reality that we have to deal with, but it has the advantage of building sustained commitments. And the backbone of global health and global health security has been constructed on long-term arrangements. PEPFAR, the President's Emergency Plan for AIDS Relief, launched in the George W. Bush's State of the Union address in January of 2003. It's now in its 22nd year. It's imperiled. But how did we preserve bipartisan, sustained commitment? It was the combination of moral and ethical and humanitarian motivations and health security. Mm-hmm. These are not antithetical. They should not be seen as antithetical. They need explanation because people are going to be uncomfortable. How did we build support for the other major superstructures of global health? For the Global Fund.
Yeah.
How did we do that? How did we get bipartisan deep support for that? For the Gavi, the Vaccine Alliance. These are the structures that have been going on now into their third decade, and the security rationale is essential for the sustainability of U.S. engagement. Ethical stuff fades much more rapidly. Now, the flip side of this is that the threats fade. Your success,
right?
Your success, when you control a threat like HIV,
people forget.
People forget. When you control measles, when you control polio, when the threat disappears, it can still be lurking in the corner and can reignite at a heartbeat, but it fades, and you have to be very conscious of that the security threat itself can begin to disappear because you're successful. Yeah. And that's one of the paradoxes of global health security and of policy making.
And one of the things that I think is really interesting is I've kind of tracked what CSIS does over the past, 10 plus years. And you and I have had discussions about how I didn't think about this in terms of national security. I did think about it almost entirely in the moral and ethical framework when I started my career. But as I've tracked your work, one of the things that I think is really neat is how you've moved, yes, infectious disease pathogens and the biosecurity threat is huge, but you also do a lot of work on non-infectious threats to global health. Can you share a little bit about that with the group, about kind of your work on opioids or climate, kind of how you think about other global health security threats?
Okay, thank you.
And then I'm going to move us to the current environment, I promise, and where we're sitting right now. But I think it's worth talking about this too.
Okay. Quick thoughts on those two topics. We've launched a major working group effort last fall on climate and health. And we have just, Catherine Bliss and I have just published a piece on the security dimensions, the national security dimensions of this interaction between climate and health. Mm-hmm. That this is something that is the argument. The national security argument is the way, in my view, to crack the divisions that exist in America between denialists and people who are embracing climate. That we have to be able to come forward with an argument that says there truly is a security dimension to what this is, and that the lived experience of Americans in what's happened in Los Angeles and what happened in North Carolina and Alabama and elsewhere with Hurricane Helene. Mm-hmm. The lived experience has become very, very real. So we have built in that security argument in saying that we need a strategy, a foreign policy that can carry us forward into the future, that looks at what the health implications are of this advancing climate crisis that we're in. So that was and it's a domestic and an international argument that we're making. I can say more if you want, but that's it. On the opioids, we began to see, back in 16 and 17, we began to see these numbers rising dramatically of opioid overdose deaths in America. And those numbers were rapidly getting to be just staggering. And we started some convenings in Washington with members of Congress and with experts who were working this and with industry. Yeah. And those that were large employers. And a couple of things kind of hit me over the head. One was that the scale of loss. Mm. The second was the fact that this cut across rural and urban. It cut across economic status. It cut across race dimensions. And it was out of control. And we did not have a strategy for this. So then I and a young woman who's now just finishing med school, Lily Dattilo, we went out to eastern Kentucky for a visit. We went to central Wisconsin. We went up to New Hampshire and to areas of Massachusetts in the drug corridor, and began writing about this. And it, as the Trump administration came in, they started off with a big commission. Mm-hmm. On the opioid crisis.
The last time around.
The first one. and it became clear that there was a consciousness of this crisis emerging, that there were technologies coming. Naloxone was becoming available. And we began pushing for that, and then it became, and that there was deep bipartisanship and compassion. Stigma is huge still, but this is sort of like your work, your pioneering work on weapons and prevention of injury and the like. These are delicate matters, huge sensitivities and stigma, but you have to be able to negotiate it. Skip forward a bit. Most recently, as we've been doing work on China, the fentanyl issue has remained at the center of our bilateral relationship, which is fraught. And at the end of last year, at the end of 23, not 24, at the end of 23, Xi and Biden met in Woodside in San Francisco for the summit, and they agreed to form a counter-narcotics working group. And Rahul Gupta, our then head of the White House Office of National Drug Control Policy, played an absolutely integral role in that. And so we began spotlighting what was happening. We're in China during the negotiations. We began privately and publicly spotlighting and exploring what was happening in those negotiations. And then more recently, we've done a couple of broadcast interviews with Rahul about what he has achieved, but we've also done private gatherings, bringing in the Trump people. And what's been striking is the dramatic convergence of opinion on what has to happen. Also, I want to add, the big piece of good news on opioids is that opioid overdose deaths in the last 10 months have dropped 17% in America. And why is that? That is a dramatic, we're still at astonishingly high levels, but it's almost 20,000 lives saved, and it's a combination of domestic policies, of expanded substitution therapy, introduction of naloxone, interdiction, trying to destigmatize this, but also getting into some tough negotiations in our diplomacy with the Mexicans, the Chinese, the Canadians, the Indians. And that's not going to go away. But I think in this case, this is a success story, and I'm hoping it's sustained.
And I think it's a great example of how this kind of health security angle can help us make progress on things that so many of us care about, again, morally and ethically, from this perspective of a human toll, but can provide another very important tool in the toolbox that can sometimes be more effective than us publishing another epi study about associations, right? Or even about causes, to use this and to kind of tool in order to facilitate action. So let me actually go then from that to action and to where we are right now. And you and I have spent time both on email and in person talking about this moment. We all know that Trump 2.0 has announced a blizzard of sweeping executive orders. And we are in the midst of, to use the words of one of our faculty, a moment of tectonic plate shifting. In the world order and certainly in the global health and global security world order. I sit in a very different space than you do in terms of how I'm thinking about trying to manage, trying to respond to, trying to protect from, trying to meet the moment of where we're at. I would be really interested in your perspective on the implications of these executive orders and changes for global health and global health security. Again, knowing that your perspective is going to be very different from mine, but that together we can probably come closer to an approximation of the truth. So,
I don't think even the people who read very carefully Project 2025 and the output of the America First Policy Institute products and some of the other products that were laying down the vision, I think even those close readers were shocked at what has happened. So let's first say, okay, we're in a moment, right? We're 2 weeks into this administration, right? 2 weeks. And what have we seen? We've seen a blizzard, a fusillade of executive orders. We've seen the emergence of this new actor named Musk, and Doge as a special force now, and we've seen a demonstration model with USAID. The USAID is not alone, but it's been sort of selected out as our leading foreign aid institution as a target for annihilation. Now, people did not really expect annihilation. They expected retribution, fear, intimidation, some damage, some bruising, but not annihilation. But we're in annihilation in this instance. Now, why did they do that? Well, there's an anti-foreign aid, nativist sort of sentiment, but there's also the desire to show that this model of action can move fast and furious at peak power for this administration. He's at peak power. He's rolled the table in the elections. He's got control over his party in both chambers. He's got sway in the court system. He's got media intimidated or on his angle side for now, and he's moving fast and furious. And so this is a demonstration model of what's possible. It has huge implications for development, for health, for food security, for all sorts of fields that AID is the globe's largest and leading foreign aid institution. And it's shocked people, and it's raised the specter that this kind of piracy that has happened, where you go in, you decapitate your senior ranks, you cancel contracts and release your capabilities, you disrupt your finance and your data system, and you leave enough shock there that you're moving faster. You're doing a lot of things that are on the boundary of the law, but you're moving as faster than the courts and faster than Congress. So the guardrails look absent and weak. Mm-hmm. So what do we make of this? Your question, what do we make of this? Yes, this is shocking. This is something that has huge implications for many, many, many programs. There's going to be a lot of suffering, lives lost, opportunities lost. Our reputation is going to suffer from the like. But I also think that out of this crisis is going to come some innovation, some leadership, some courage. And I think as we get out of we're in this blitzkrieg phase, as we move, this is not going to last forever. It cannot be sustained. We're in a dark moment. It's going to get a little darker, but we still have to believe that that some of the guardrails are going to swing back, that creating coalitions, being calm, staying patient, not reacting to every last thing, and trying to come up with a strategy of engagement that can bring us back to a reform agenda and a restructuring agenda. And we're going to need bipartisan bases of support in order to resurrect and get things back on track. And we have to admit to ourselves that it's not going to be a return to status quo ante. It's going to be something different. It's going to be smaller. There's going to be more private sector involvement. It's going to have a different look. And that's going to be part of the work and the career pathways of many of the people in this room. And it's something that faculty and researchers are going to be important in trying to carry forward and brainstorming on, okay, what comes next. No one was preparing for a future with an obliterated USAID. PEPFAR has a relationship to USAID. The PEPFAR program was, early in this crisis, it was given a carve-out or a waiver that was a partial and very vague waiver, and it took several days to get a little bit of clarification. But the meds program, the antiretrovirals, and the mother-to-child intervention programs are supposed to be continuing. But when you take away your staff and you take away you disrupt your data and financing systems.
Makes it pretty tough to continue.
Getting somebody to execute on anything becomes very difficult. So there's still enormous uncertainty and paralysis out there. Every day, under normal circumstances, 220,000 people under PEPFAR come in for their meds.
Yeah.
So, and when you disrupt that, your kickback in infection pretty fast.
So if we go to the kind of addressing the moment, right? So thank you. That was I really appreciate kind of your diagnosis of where we are. And I think it's important for us to be clear-eyed about the moment that we are in, as well as the uncertainty, the total uncertainty about what we're facing. But I think you and I are united very much in the idea that when you, just like with HIV/AIDS, just like with 9/11, when you face a crisis, there is a moral and ethical obligation to step into the crisis and create solutions. And so I'm curious from your perspective, kind of what you see as some of those next steps that either you're taking at CSIS or that you would like to see, you would love to see some of our students or faculty or staff take on within academia. I didn't prep you for this question fully, so I'm kind of throwing this at you. Yeah.
Well, I think that we need to be listening to the critics of these programs and understanding better what the critics are saying. That's one step. We cannot dismiss the critique. I still think there is a residual baseline consensus among conservatives and liberals around the value and of carrying forward in these areas. It's been overshadowed and overtaken by this radicalization that's happened, but it's still going to be there. We've hosted a number of gatherings before we got to the inauguration, which revealed a strong consensus on a reform agenda. We have to bring it back to what are the essential reforms. The crisis we're in right now has in part happened because of a resistance to reforming the institutions themselves.
Yeah.
That created a vulnerability and a frustration. There have been calls for reform of PEPFAR for a long time, and there's been fierce resistance to it. There's been calls for reform of USAID, and there's been fierce resistance. So now we have a sledgehammer versus a scalpel approach. So we need to sort of get back to what is a reasonable, actionable reform agenda that can be enacted that will restabilize. And how do you get there in this moment? Part of it is trying to figure out who needs to be at the table for those conversations and try to get them to those conversations. And it's not going to be one conversation. It's going to be a very concerted process. And some of that should not be done publicly.
Yeah.
Some of that should be done in very private circles. I think those who are studying programs, who understand the mechanics of programs, those who understand the architecture and the, as you say, the public health and biomedical dimensions of that, have a very significant role to play in this. In other words, the talent, expertise that is here should be part of that. Question is how to do that. We, in all of our work, we bring in university-based experts. Colin Carlson,
yes,
who can't be with us today,
has the flu. Yes.
Has the flu.
I'm sorry.
Kindly has joined, our working group on climate and health.
Yeah.
And
you and I have worked together on stuff around the post-COVID era, and but post-pandemic.
So has to be this blending of talent and perspective around a pragmatic reform agenda that's going to get us back to where we need to be.
And when you kind of talked a little bit about trust there and kind of that challenge of bridging, and I think it's one of the things that CSIS does really well for kind of students, and we have a lot of discussions about this, about how do we connect with populations, how do we have kind of compassionate dialogue, how do we engage in discourse with people who may not trust us. What would you say to kind of students or faculty or staff in the audience around that aspect? Because it's something that I think you do so well, is create space for dialogue and shared forward movement.
Well, one of the problems that schools of public health, elite institutions face is that they don't interface much with that part of America that has seen its trust and confidence in public health institutions, in science, in universities decline precipitously. And so how do you correct that? And this is in an era of misinformation, disinformation, in which the machinery of stoking that distrust is pretty fierce.
Yeah. And
the counter tools are not up to the task. We've seen this, right?
Oh, yes.
And the former Secretary of HHS Becerra, in some of his interviews at the end of the Biden term, one of the things he said that was very striking was his reflection that in the course of his tenure as secretary, that they had been overwhelmed and overrun by the forces of misinformation and disinformation, and they didn't have the budgets or capabilities to deal with it. So what does that mean for a school of public health? It means that in order to break out of that isolation and bridge to those communities and understand who they are and get them to listen to you, you need a strategy of engagement, right? And a strategy of outreach, and you need a communications capability that may require a creation of a new set of platforms. And you've got to go where they are, right? In other words, you've got to be doing the big scale podcasts that have become so powerful. You've got to be in the social media layers, the sort of workshops where all this stuff gets propagated and fighting. You can't be outside of that. And you've got to figure out how to reach those 18 to 34-year-olds who are becoming young parents who don't believe in vaccines or who are skeptical or who are, when we look at the measles or the pertussis rise, there's been a huge shift in our populations. And I don't mean to suggest any of this is easy. I think that breaking out of isolation and reaching that population in a meaningful way and restoring trust is really hard. Mandy Cohen, as the outgoing director of CDC, came and Richard Burr and I had a broadcast conversation with her last day of her service to this country, and we asked her, because of course the CDC faces terrible challenges, and she enumerated several innovations they had made. They changed the style of language they use.
Yeah.
They've changed how they target people. They changed the speed in which they move. They have experimented. They've moved towards focus groups. They've moved outside their building. They've moved into communities. They've identified those trusted, network of messengers and inform people to inform them. But that's a big operation. But I mean, you've got Ann Zink now working with you, who's, led the way in thinking in those terms, which is, a great asset for you. So, I mean, the people who have been thinking hard about how to overcome this gap.
I'll say there, if there are any students, Ann does a monthly podcast in Alaska, which is where she was chief medical officer, and I'll be sending something out soon for students. She'll be looking for a couple of student volunteers to assist with her podcast, as a side note. But I didn't pay Stephen to say all of that stuff that is PS in our strategic plan, and I think part of it is partnerships between organizations like CSIS and our school, and then the partnerships outside as well. And so I really appreciate that perspective. I am going to open stuff up. I have 10 more questions to ask, but as I figured, we would kind of, the discussion is so rich that I don't want to keep going with my kind of prepared questions. I would love to hear from all of you about what's on your mind, what you would love to hear about from this true international expert. This is your chance. So folks in the audience and online, we're monitoring Zoom for chat as well. Please raise your hand and ask Dr. Morrison your burning questions.
We can start with a Zoom one if you want. We did have a Zoom question.
Oh, that's fun, starting with Zoom. Go for it.
We have like 80 people on Zoom today. The first question we got on Zoom was from a student that said, I'm very concerned about what's happened to U.S. aid. What are your thoughts about this change? But more importantly, how do we move forward as a global health community?
Well, we've touched on that. It's a great question. I
guess, how would you say to folks here? So we have a lot of people here that are actively doing global health work. What, from your kind of and I have my opinions, and I'm happy to weigh in too, but from your CSIS perspective, what would you say to the folks that have active collaborations or research studies internationally? Do you think the decline, the dismantling of USAID impacts, like?
Well, it's hugely disruptive, because it's woven into those enterprises. Yeah. And we're going to see reductions in some of the other funding streams. We haven't seen what's going to happen with NIH and CDC. Expect reduction in resources. Expect some disruptions, but don't jump to the worst conclusions. In other words, don't settle into a position of complete despair. I think that you have to, as we were talking earlier, you have to remain...
Easier said than done, I understand. Yes, go ahead.
I mean, I think we're in an extraordinary moment of crisis. And as I said earlier, it's dark and it's going to get a little darker. But the guardrails seem to have disappeared. The guardrails are going to come back. The guardrails are going to be courts, Congress, and independent institutions like the universities and partners of the universities and those that can form coalitions and act in concert. So don't be passive, don't be resigned. If we move towards indifference, if we move towards silence and resignation, that's defeat in this particular moment. And don't abandon the thought that bipartisanship can be restored around what you're doing, but it's going to reshape the environment. We just don't know. As you were saying earlier, there's enormous uncertainty around this, and we have to be humble about what comes next, because each day is throwing us a little bit off balance, and we should be conscious of that.
And you said to me earlier when we were talking about thinking there's the short term, but there's also the mid and long term strategy. So I think that for many of us, this is a moment to think about that mid or long term strategy. And I'm going to say, Brian, you and I had a conversation yesterday about what would you want to create, right, in this moment of vacuum? What is it that you would want to create, and how can you start to create partnerships to do that? I think about how PEPFAR came about. That came out of, I was in West Africa in the late 90s when there was no access to antiretrovirals, right? It's part of why, like many of us of my generation, why I went into public health. I think, but had we not had your imagination and Bill Frist's and John Kerry's, we would not have ended up with PEPFAR, right? And so I think there is a moment of like, yes, acknowledge your emotions and the tremendous disruption, but also lean in to what you want to see happen and start thinking about novel ways and novel coalitions to create it, right? This is not, to quote you, like, this is not a moment for, like, when we give up, then hope is lost.
Right.
And I think you've been an amazing example of that over the course of your career, of shedding a light on problems that nobody else was talking about, and then creating coalitions to create positive change in some really creative ways. So, yeah, okay, we'll go to questions in the audience, yes.
Hello, thank you very much for being here. My name is Andrzej Zinchuk. I'm one of the faculty at the School of Medicine. I appreciate your perspectives. I have a couple of questions. One of them is a little bit more general and related to trust between places like Yale and their communities, or the communities at large, let's say in Connecticut, and how to engender that. And programs that you have suggested, including getting involved in the community, going out to meet your audience, require funding. And so my expectation based on the current climate, that funding is going to only decrease. And so are there specific partnerships with industries or healthcare organizations that we should be thinking about to help fund some of that work? Because I think at the end of the day, we're trying to do something with some base of evidence, which should improve outcomes. And so most rational people would feel like that would be important to whatever the mission is that they are conducting, whether that's business or healthcare or both. And so I'm just wondering, what are your thoughts on this? That's the first question. And then the other question I have to ask you, which is a bit more personal, and I had to write it down a bit. And so when you mentioned that, I wanted to sort of echo your emphasis on the importance of public health as a really key piece of security, especially when you talk about the implications of chronic health issues and how, for example, impact of work healthcare workers and infrastructure that is needed to mitigate the stress of that war, and for a particular country, for example, to even survive that war. Ukraine is a clear example of this. I'm Ukrainian myself, and on faculty, I run a nonprofit organization here to support some of the Ukrainian physicians and scholars here. And I wanted to give a shout out to Kaveh Kushnad and Dr. Poole of the Humanitarian Research Lab at Yale, who have documented some of the atrocities that have occurred in Ukraine. And I think that's really, really important and critical. But I also wanted to get a sense from you is how can we convince the U.S. government to focus on supporting not just Ukrainian healthcare, but other countries who are strategically important to the U.S. In a way to address the security threat. So maybe moving beyond or complementing our documentation, but to activism and rapid cycling short-term project that can make an impact. So those are two questions. Thank you for taking notes and being patient.
Thank you. Thank you very much. I think it's fair to expect that in this moment of crisis, private sector and philanthropic interests and faith interests are going to step forward in a higher level of engagement in this period, and that there are going to be more opportunities for partnership and not fewer. Mm-hmm. And that may not be visible today, but it's going to be visible soon. And we should be, as a university, you should be very strategic about this in understanding the evolving environment of corporate, philanthropic, faith-based, and other interests that are going to be looking at this and thinking, how do we respond it doesn't. You're right that you're not going to have federal funding in an expansionary mode in these type of bridging things that I was suggesting that are very important in order to win back trust and understand what is going on in America and why is half of America rejecting public health. That is a huge challenge, and it is that half makes it much easier to obliterate institutions today than if that trust were there. If that trust had been there, it would have run up against a completely different environment. So you have to strategically address that. But I also think that we are going to see forces within our society step forward in new ways to seek to address this, and they're going to be looking for partners. So I'm hopeful in that regard. We saw this earlier. You can cite many earlier instances of crisis where this happened in America. We're blessed by having such a strong civil society in that regard. Right now there's intimidation and there's fear, but there's lots of people in their institutions brainstorming over this, and they're going to be looking for worthy partners who are going to amplify their reach, amplify their capabilities, bring skills that they need to the table, and come up with solutions that can be propagated and pushed forward. On the question of war, and we have done, as a government, we have done a reasonably good job in supporting the response in Ukraine. Not a great job always. There's certain things that we've hesitated to get involved with, like the war wounded and AMR has been a highly sensitive issue internal to Ukraine. And it's been a source of controversy within our military and elsewhere about how to structure that response. But we have certain capabilities that are very strong in that area, and I would hope that we will continue to see these attacks upon the health sector in war zones as completely unacceptable, and ones that we have to take a stand on. It's the institutions that are the guardians of that, the International Criminal Court, the ICR, International Committee of the Red Cross, which is a guardian of humanitarian law. These institutions are fragile. They're frayed in this particular moment. Some of the other institutions that stand by them, like MSF or IRC, they need support, and we should be providing support to that. We've had obviously some huge setbacks in Gaza, in the violence against the medical system and the destruction of the medical system and the targeting, and we've seen it in Sudan on an equal scale, and the U.S. is going to continue to be called upon in places like Sudan to play a very important role in the response. The emergency programs, I don't think, are going to be completely dismantled because of their special history. And so I would be a little more hopeful that we're going to see some greater continuity in that regard, and the issues that you raised remains terribly important.
And of course, Kaveh is sitting here and met with you earlier, and so kind of those collaborations with HRL, and as we are actively trying to expand those, I can't speak on behalf of the med school, I can speak on behalf of the School of Public Health in terms of the amount of importance. And again, you all know it from our strategic plan, but just to say out loud, I am spending a lot of my time on creating those creative partnerships. And I know that many of you are as well. I think that it is the only way that we lean into this moment, is thinking about how we create, and Yale Ventures has been a great partner to us in this, both in the private sector and in the public sector. If we look at when you and I were talking about COVID earlier, when you look about how we got through COVID, it was through some of those unexpected areas of collaboration that really helped us respond to the crisis in those right until things stabilized in those first 6 to 9 months. It was those unexpected partnerships that provided solutions and hope for so many of us. And so personally, as a dean, I would encourage exploration and leaning into those. So
My name is Luke Davis. I'm a faculty member here in the School of Public Health. I want to thank you for this excellent session. I really appreciate it, particularly the solution-oriented approach, and it's kind of a very helpful way to have this dialogue. Much of my work is NIH-funded research that's focused on the HIV-TB epidemic and is very entwined with USAID and CDC-funded programs and PEPFAR. And my question for you is that in terms of this area of health diplomacy, I think many of us here are very value-driven, and we think about our values in terms of these programs, but I think the other aspect that I often hear talked about is our interests. And looking specifically at this administration, where many things are focused, approached transactionally, what a quid pro quo. What advice would you have for us in this room about talking about our work in terms of the investment case for PEPFAR or TB programs or any other aspect of global public health? I'd be interested in your perspective from where you sit in Washington. Thanks.
Thank you. One of the greatest challenges right now is that the talking points or the playbook that we've been using for the last 2 decades to sort of make the case suddenly doesn't seem to work. Suddenly doesn't seem to motivate or even register with the current government that is in power and with apparently a large segment of the American population that supports that. And so your question is, do we refresh those talking points in playbook? Do they remain valid, but only in a changed context? In other words, I don't think you're walking away from the fundamental arguments around values and national interests. Everything has to be grounded in those things, ultimately, and return on investment. And so I think you don't give up on that, but somehow we need to be refreshing ourselves because the language we're using and the people that are delivering the messages are not being heard because they're running up against a wall of skepticism and distrust. And so what is it that needs to change? The fundamentals don't change, but something has to change in the expression, the manner of communication, the delivery of it, the context in which it's understood and delivered. And I don't have a ready-made answer for that, but I do think we need to be very honest with ourselves that we're at this moment where suddenly what we thought was registering and valid and shared is less consequential and influential. And we don't just abandon that, but we need to rethink and retool our approach. What do you think?
Yeah, no, I totally agree. And I actually think that's one of the places that we can and should lean in. And it's one of the places that CSIS to me is so special in your creation of these spaces. And it's, yes, to students who have to leave to get to class, we know that you're not walking out of frustration. Have a good class. We know that, right, that you create these closed door moments where people who you may think of as coming from very different lived experiences or ideological perspectives can have honest conversations and move forward. That has been unbelievably helpful to me. I think that we also as a school can create some of those spaces for very small and private, right, opportunities for us to listen to each other and talk to each other and to test messages and values and figure out where we have alliances. Because I do still deeply believe, and I know that you do too, that we actually have more in common than we have differences around. And I think that anyone in this room would agree that the way things were going was not really sustainable. We have very different ideas of how to create change, right? And how to create the world that we all believe in. But I do think that each of us in our relationships and in our communities can have those conversations and we can figure out together and then bring back to people like Stephen, or maybe do it in collaboration with CSIS or with others who can maybe bring other folks into the room, that it's an invitation for us to lean in and to start creating those new messaging strategies that were needed. I mean, you and I have had this discussion long before the November election, right? We knew that this work had to happen, and now there's a new urgency. And so I think it's you, and you'll sit with your partners globally as well as locally, and maybe bring some new organizations in. And I think if I go back to those of you that are first year students in our compassionate dialogue session, it is a chance to actively listen and to really hear what people's frustrations were, but also what their hopes are. And that's how we start to create the new messages. I think there's more needed too, but that's at least a starting point.
Thank you.
I don't know.
Well, I think it's important to remind ourselves that the progress that we've seen in the last few decades is pretty astonishing.
Yeah.
It's pretty astonishing. It's been through sustained commitment. It's been through a coalition of actors. It was an oddball coalition originally, right? I mean, you had strange bedfellows coming into this coalition. You had people of opposing outlook ideologically and culturally. You had the entry of corporate interests in a deep way, far deeper than what people had anticipated. You had the entry of new and very powerful foundations that entered the equation and have become
Global Fund,
very
Gates,
important.
none of those existed 40 years ago, right? Yeah.
And we have a faith community that was a glue to much of this, and they have fractured in some ways, and we've seen not a disappearance of any of those interests, but we've seen a weakening of some of this. The bipartisanship has become weaker. The role of the faith community has become weaker. And so part of this is deliberately going forward in how to revitalize what has been an essential element of the achievements we've had thus far, with a focus on reform. In other words, it's not status quo, it's admitting the need for reform. Yeah. It's admitting the need to have higher performance standards, to have end game standards, to have higher local ownership, to have deeper localization, have deeper private sector engagement. Those things have to be in the picture, and there has to be a signal of a willingness to be self-critical and be reform-minded to get that coalition back, I think, and to get Americans to think again about this. When you think back about the magic moment of 25 years ago when these institutions were being created and the support was being, one of the things that happened there was that travel intensified into the zone where the HIV epidemic was concentrated. And this became, for a period of time, a very important instrument in changing perception and winning over stalwarts, skeptics to stalwarts. And it may not be that travel becomes the same tool as before, but it was a creative action. Mm-hmm. You know, I remember Tommy Thompson loading up a 747 with a bunch of corporate guys in dark suits and running them off to places in Africa they'd never imagined going to. It had some impact there.
Well, I think that's a wonderful note to end on, both around kind of places that we can lean in and also about the importance of creativity and not knowing what that next tool will be that will get us to where we see a better future existing, and also a belief in the power of this community to impact that. That doesn't change. I will put in a plug for his podcast. If you want to hear more of this type of discussion, he has the most fascinating guests and conversations. So do sign up for the CSIS podcast.
The CommonHealth.
The CommonHealth. And can we please give a warm round of applause for guests?
Thank you. Thank you all. Thank you very much.
I have a little swag for you because you can't leave Yale without swag. So a little something on behalf of the School of Public Health. Thank you.
Thank you so much.